Hi, welcome to Johnston Health Talk. I'm Liz Thurston, liaison with Johnston Health. Today we're talking with Murray Dees, and Murray is a native of Johnston County. She received her bachelor's degree at the North Carolina State and her master's in social work at UNC Charlotte. Murray returned home to Johnston County in February of 2014 to work for the SECU Hospice House as a social worker. And Murray's here today to talk with us about hospice care and also about 5 wishes. Welcome to the show, Murray.
Thank you. Thank you for having me.
So I think this is such a great and important topic to share with the public and to educate them about what hospice care is, and then later on talk about the 5 wishes and what that is. And I think that's important to everybody, whether you're sick or healthy still. Right. So talk to us, what is hospice?
So hospice is an end-of-life treatment option. I think people have a negative view on what hospice is just because of the history of it. And I've actually been through the history of it, and it hasn't really evolved into what it is now until maybe the last 10 years, okay. I think. So it is an end-of-life treatment option. It is for individuals with a terminal illness. So Medicare defines that as having a life expectancy of 6 months or less. That's not to say that our patients won't live longer than that, because we have had patients to graduate from hospice, or their disease process takes a little bit longer because every patient is different, and the disease may present differently in their bodies.
So what services are we offering when you have hospice? I know there's in-home hospice, and then there's also a hospice house.
Yes, so with Johnston Health Home Care and Hospice, we actually do home hospice. So we go into the patient's home. A lot of patients do want to stay in their home because that's where they're most comfortable. That's where they live, that's where their family comes to visit, that's what they're used to. And we try to keep patients' wishes in mind for the entire time that they're under our care, because the patient is the most important and their comfort is what is important to us. So through home hospice, we have a nurse, a registered nurse, who comes out weekly, 1 to 2 times a week, anywhere up to 5 times a week. They'll check their vital signs, check their medications. They actually order any hospice medications for them, and they get delivered to the home, so that kind of eliminates that barrier of the individual having to go out and get those medications. Mm-hmm. We have certified nursing assistants that come out up to 3 times a week to help bathe the patient during hospice care and the end-of-life journey. Bodies get weaker and patients are less able to do for themselves like they had been. So nursing assistants help provide baths and linen changes in order to promote the safety of all of our patients.
So Murray, how does an individual get on the program for hospice care? Is that referred by their physician, their primary care doctor, or maybe a cancer doctor, that kind of thing?
Yes, so in order to even have an informative visit with hospice and learn more about hospice, we have to have a referral from a physician. Okay. That can be any physician that you see. Most of the time we see either oncologists or cardiologists or primary care physicians.
So there's hospice services in many counties. Mm-hmm. Is there anything that's special about Johnston Health as far as their hospice services? I know we kind of concentrate on a couple things to make people comfortable and happy.
Yes, so there is. Through Johnston Health Home Care and Hospice, we do have our SECU Hospice House. Mm-hmm. It is our inpatient inpatient facility under that Johnston Health Home Care and Hospice umbrella. So our patients, if they are experiencing any kind of acute symptoms in the home that are unable to be managed in the home properly, that could be intense pain, nausea, vomiting, shortness of breath, anxiety, agitation, we can bring them into our facility. The hospice benefit typically pays 100% of that. We can work on their medications, get them more or less stable in the sense of their symptoms are stable. They're more calm with their scheduled medications too. And then we can send them back home, or some of our patients stay with us. We do have residential patients that it's just either they have family that lives out of town, or their family members still work full-time and they're not able to provide that 24/7 care that is needed in the home. So we do have patients that stay with us longer than just an acute patient working on their symptoms.
So what is your role as a social worker? How are you working both in the home as well as at the hospice house?
Yes, so mainly I'm there for emotional support. I get to know the patient on an individual level. I get to know them as a person, not just a diagnosis, not just a sickness or a symptom. I know them, where they're from, how long they've been here, how long they've been married to their spouse, how many children they have, hobbies that they have. Because I want to provide that to them. I want them to know that they are still important as who they are. I also provide emotional support for the families because they are going through a lot. They don't typically take time for themselves, which is very important because they want to focus all their time and energy on their loved one, which is understandable. But I'm there to listen. I hear a lot of issues that go on in the home, and then people just come and vent to me and tell me what's going on in the home. So I do a lot of listening. I can also provide any resources in the community. Our home patients actually are able to get things like Lifeline, Life Alert, just to help make them feel more safe in the home setting. And I can help link them up with that, link them up with ramps, other assistive devices. I can also arrange transport to and from the hospice house. So we actually had a patient in our hospice house who, she was stable, she was doing well actually, and she wanted to go home. She wanted to live in her home because that's where she felt most comfortable. So I worked it out with her sisters and we got her home, and I actually just went out to her home this week and saw her, and she's doing wonderful. So we're able to provide that care and support in the home. So she's safe, so she's taken care of. And I set that transportation up just to make sure that, you know, from point A to point B, she's taken care of.
Yeah. And I think it's so important that the family has the resources to go to, because you're so worried about your loved ones, plus you're trying to take care of them on your own, and you just can't do it all. And having hospice services come into your home, or if you're using the hospice house services, at least you can concentrate on spending quality time with your loved one instead of having to do all the laborious work that goes along with that, or trying to figure out medications or bathing. Mm-hmm. You know, I just think it's so important, such a great service that we have, and to provide that to the community for sure. I know touring through the hospice house, and even in the home setting, you know, a lot of people want to live their last days at home and making them as comfortable as possible. But if you can't be at home, making that environment like home, bringing pictures in. They talked about bringing dogs and animals, whatever makes the patient happy. Keep an open mind to that. And it's really just about quality of care, quality of life for what you have left, right?
Right. We actually had a home hospice patient come tour the hospice house this week, and she said, well, this is just like home. I feel like this is home. And she wanted to sign up to come in for a respite stay, which we do offer hospice patients. They can come in for a 5-day period to give them a break, to give caregivers a break, because we all need a break from time to time. And it's hard to convince them to use that respite period, but she's coming in, she's excited about it.
Let's talk about advanced directives. Why are they so important for us to define what our advanced directives are?
So advanced directives are important not just for hospice patients, but for you and I also. There may come a time where we are not able to verbalize what it is that we do or don't want as far as healthcare decisions go. The state of North Carolina has different laws and different people related to you that can make those decisions, but it's often very difficult for family members to make life-altering decisions for loved ones, especially if it's a sudden accident that happens and they're forced to make a decision. Those different decisions can cause a lot of guilt in loved ones. Yeah. So to be able to put your healthcare wishes down on paper and have it to give to your loved ones. It starts the conversation. It starts talking about what you do and don't want so that they know what decisions to make for you if ever you can't make those decisions.
Yeah, and I think the 5 wishes, which I didn't realize this is across the nation, so just to kind of hold this up so people can see it, that the 5 wishes are about you and what you want, whether you're sick right now or healthy, defining what your wishes are for when you become sick, who's going to take care of you, do you want life support, those kind of things. So let's talk about, if you don't mind going through the different wishes.
Absolutely.
I was reading through this morning, and it's so important. I mean, like I said, even if you're not sick right now, you need to define these, because something could happen. You could cross the street and get killed, or you could just not killed, but in the hospital. And somebody needs to know, if you can't make those decisions on your own, somebody needs to know what your wishes are.
Right.
So talk to us a little bit about that.
So like you said, this is a nationwide document. In 42 states and the District of Columbia, if you have this document notarized, it is a legal document.
Okay.
So the very first wish of the 5 wishes is you can designate someone to be your healthcare power of attorney. So that means if you were ever deemed incompetent, or you were not alert or oriented any longer, not fit to make decisions for yourself, this person would step up and make decisions for you. Mm-hmm. So whether that is feeding tubes or life support or a do not resuscitate order or any treatments, things like that, they would be able to make those decisions for you. So it's very important to think about who you want as your healthcare power of attorney, someone close to you, but also someone that you know is able to make the decisions that you want, and that they're not going to have a hard time, even if your decisions might seem a little difficult for them to make.
You're right. Yeah, and if we could just want to go through the wishes. So the first wish is the person I choose to make my healthcare decisions for me, which you just talked about.
Right.
And so knowing you well, caring about you, stand up for you, and someone that lives near you, because you don't want them to be far away.
Right, right. And we do encourage you to let this individual know that you have chosen them. Don't just assume that they know. The second wish is actually the kind of medical treatment I do or don't want. So this goes into, the 5 wishes actually gives you 3 different scenarios of if you have a terminal illness and your physician deems it impossible for you to get better, either treatment's not working or whatever it is. Do you or don't you want a life support machine? Do you want a feeding tube? Do you want antibiotic treatment? Things like that. So it goes into different scenarios of what could happen to you and what you would want done for you.
Yeah, and then there was a section too, and if that scenario is not listed, kind of like an other opportunity too.
Right, you could write in notes in any of these wishes.
Okay, and then wish 3, which I just skipped over.
Wish 3 is how comfortable you want to be.
Okay.
So this includes, and this is probably my favorite wish, because it goes into what kind of things you want. Like what kind of music you want played in your room. If people don't think that you're hearing them, what do you want? How do you want people? Do you want people to talk to you? Do you want people to come visit you? Do you want pain medication? Do you want anxiety medication? Do you want to be treated for temperatures? Things like that. So it actually lets you go in and choose. Yes, I want to be massaged with warm oils. That is actually one of them in here.
I saw that.
Cool washcloth. Do you want anxiety medication if you are exhibiting symptoms of anxiety?
Yeah, there was even I was surprised to see, do you want your nails clipped? Do you want, your hygiene kind of stuff?
Right,
because you
exactly.
do. I mean, you just automatically assume that that's going to be taken care of, but you can specifically list that on this. And then the next one also, it goes to the emotions of, being sick and having an illness. how people treat you. So do you want somebody to hold your hand or sit with you, or do you just want to be alone? Because people have different needs. We assume everybody wants us hanging, we want people to hang out and be with us, but you may have times where you don't want people in your room or around you or touching you. And then praying, most people would want to pray, some do not.
Right.
So I thought they were just really neat when I was reading through them. Do you want pictures in your room? Are you going to, do you want to, pass at home, or do you want to be in the hospital when it comes time?
Right.
So those are just so important. And then the fifth wish, I'll let you talk about.
What I want my loved ones to know. So this is the part where you can leave anything for your loved ones, including funeral wishes, so what hymns you want sung at your funeral, if you even want a funeral, if you want to be cremated, if you want to be buried. But also, I think there's different ones in here that say, if anyone asks how I want to be remembered, please say the following. The most important thing to me was, and you can fill in the blank. So it's a part where you can really tell the people that you love how much you love them and how you want to be remembered.
Right. And this, as we said, I think we want to stress that it's available across the nation. I think there was 42 states. Oh, 42 states
in the District of Columbia.
Okay. And so where would we find this program? I mean, where would we find information? Online?
Yes. So their website is actually agingwithdignity.org. That's where you can order the 5 wishes. You can learn more information about them. I'm actually doing a presentation specifically on the 5 wishes on April 14th at the hospice house, just to go more in depth about it, the importance of it. Our medical director, Dr. Coffer, loves this document, and he stresses it even with his patients that he does surgery on that are not hospice. So I've had some of his patients come to me and get these documents. So anything like that, and they're easier to understand. So it's used in a language that we can all understand instead of the heavy medical jargon that confuses all of us.
Exactly. When you read legal documents, sometimes you're just like, what does this mean? And if you're elderly, you get a little confused. I mean, I'm getting elderly, but you get confused reading that. The legal jargon is really hard to understand. And you're right, reading through this is very simple. Anybody could sit down and look at it and make those decisions.
Right.
And then, like you said, get it signed and notarized, and it becomes a legal document. We want to make sure that your doctor has a copy, the person that you've designated to take care of you or to make those decisions for you, and then having the original copy close by. I think there was also a little card that you could carry with you.
Yes, you can cut out the card in the back and fill in all that information.
Okay, that's great. And I just wanted to stress too, and kind of hold this up if we could. Well, probably can't see it all, but Murray is presenting this on Thursday, April 14th. And you can go to our website to look at that, get more information. That would be at johnstonhealth.org. And April 14th at the Hospice House in Smithfield from 1:30 to 2:30 p.m. And so just some more information on that on our website. Murray, just to kind of want to touch too, we've talked in the past about the winter blues, and you're dealing with that as a social worker. You see patients that may be dealing, or you may not be seeing them because they haven't been identified as having the winter blues. Tell us what the winter blues is.
So the winter blues is depression and anxiety that can be felt in anyone, but it's more specifically related to the fall and the winter months. Seasonal affective disorder, it's also called, but we refer to it as the winter blues. But it happens when fall begins because we have less sunlight, we have less daytime. There's more darkness, it's cold, it's dreary, nobody wants to go outside really. I know it gets dark before I even leave work to go home, and it's dark when I'm driving into work. And it just can kind of make you feel depressed. It can make you feel down. And older adults are no different than younger adults.
Yeah, and thankfully the sun is starting to come out now, and it's getting a lighter earlier, but it's depressing when we get the snow and the ice and the rain through the winter time, and we don't realize, we get so kind of caught up in our own lives, we may not realize that a loved one is having these winter blues.
Right.
And how do we know if it's just a spell of the winter blues or if it's actual depression? Is there a difference between the two? Are there certain signs that we need to look for?
There's a few differences. Again, if it's more in the fall and the winter months, and you see a difference in them during the spring and the summer, but it's a depressed mood, lack of energy, sleeping more, maybe appetite change. I know with seasonal affective disorder specifically, we crave more foods high in carbs. So if anybody's gaining any weight, a significant amount, 10 to 15% of their body weight in a short amount of time. If they are easily able to snap at other people, so easily angered, distracted, if you notice it and it's actually affecting the individual's life, is when it starts to become a bigger issue.
So are there things that we can do in our home to kind of prevent some of those winter blues, or to make them a little less, severe?
Yes, so exercise always helps, but during the winter, it's not as easy to get out and walk around the block or to walk your dog. But I know at the medical mall, we've talked about this before, you can walk around the medical mall. I've actually met many family members of patients of mine that go and walk every day at the medical mall. You can get involved in different activities. So we do have community and senior services in Johnston County and in Wake County too, that they have nutrition centers where you can go and you can spend time with other individuals your age, where they do programs and they learn about things, and they even share a meal, I think, weekly. So to get involved, not fully succumb to wanting to be alone and to withdrawing and just staying inside your house, because it is easy, and the older that individuals get, the less able they are to drive themselves, the less able they feel like getting out of the house, maybe for fear of their own safety, fear of falling, things like that. So if you do know an older adult, please check on them, call them, run by, visit with them, because that helps all of these things. If anybody knows that somebody cares, and will go an extra mile just to see that they're being taken care of, it helps a great deal.
Yeah, and we talked about that before, that you kind of lose track, that you don't think about the aging process and how that affects you. I mean, just as the different stages of life that you're going through, your children are gone now, they're all grown up, they're married with their children, they're not spending as much time with you, or you've got, like we've talked about, too much family coming over,
right,
which could be, change your attitude and make you feel depressed. There's just different life-altering things that can happen at the different stages of our life. And as you get older, you're spending a little, more time alone. And so to get involved with community events or different organizations for seniors is a great idea as well. So do you see that if somebody's feeling this way, is there a number they can call, someone to talk to, Murray, or how do they handle that?
So you can always call myself. My office number is 919-209-5104. So I can sit there, talk with you, or I can always refer out to a different therapist and somebody else that might help. Talking with your primary care physician is probably the most important, because they follow you throughout your lifetime, throughout the different doctors that you're going to. Your primary care is the main one. So I would stress talking to him first.
Okay. Well, this has been a great show. I mean, to learn about hospice services, no matter what county you live in, those services are available. Inpatient care we do have in Johnston County at the Hospice House. And then just learning about the 5 wishes, I think this is just great information to share with all age groups, very educational for everyone. And then just being aware of the winter blues and whether it's depression or winter blues, there's services out there. Talk with your primary care doctor or call and talk with Murray and she can get you the services that you need. I just think this is great education for everyone. So thank you so much for joining us today, and we will definitely be bringing you back for some great topics ahead. And again, I just want to stress that if you want to learn more about the 5 wishes, go to our website, johnstonhealth.org, and there's Murray will be presenting this information on Thursday, April 14th from 1:30 to 2:30 at the Hospice House in Smithfield, or you can call her, and your number again, Murray?
It's 919-209-5104.
Great. Thank you so much, and thank you for joining us for another episode of Johnston Health Talk, and please join us again with a new episode. Thank you.